of average Nigerians is not even getting those diseases as such. It is the response and the things that we have in place to take care of those. I remember we celebrated when WHO certified us as a polio-free nation a couple of years back. As I'm surprised, last week when I saw the pages of the newspaper that some communities and states in Nigeria are recording fresh cases of polio. And I'm like, how did we get here? There is a big investment coming in from the Gates and Belinda Foundation on malaria eradication in Nigeria. Millions of dollars being pumped into the health sector in Nigeria. Where are those monies going to? Because we stay in Lagos, and then you think, oh, on the average, you can still say maybe there are still decent government hospitals around. Sometimes you go to there was a time I had a friend of mine the friends who had a medical emergency and he was not around. So he called me, oh, let me go, let me pick the car, pick my wife and take her to the hospital. When I got to the hospital, they told us there was no bed. And she was heavily pregnant. So I had to call one of my oga that called someone in the hospital. Then somehow, after waiting for almost 35 minutes, they managed to give her a bed. And then I imagine how many people are going to be in that situation that they don't have anybody to call that can help that medical emergency. That is Lagos. Then go to state like Taraba. Go to state like Zamfara. I'm not saying those states don't pay attention to things, but the concerns of those places, there are health centers in Nigeria where when people are admitted, they will hold the drip with their own hand while they're on admission receiving drip. These are issues that worries a lot of Nigerians. By nature, you can fall sick. That's the fact. But do you have a system that takes care of you? So, if we're talking about these diseases, I remember when COVID-19 came into the country, a lot of people started worrying. Oh, can we handle it? Can we take care of this? Can we do this? Can we do that? So, and it became an issue where people had doubt. Oh, it didn't happen. We don't have this. We don't have this. But it became a pandemic. People died of COVID. In this Nigeria, people died of COVID. You know, I remember when it was the case of Dr. Irene Adadevoh, and then she had to literally pay, the sacrifice. Ebola, putting her life on the line. Imagine if it was not contained in Lagos. There are countries in Africa, Congo, that are still dealing with Ebola today. There are countries like Sudan that are still dealing with Ebola today. Imagine if that Patrick Sawyer, the guy that flew from Liberia, did not touch that in Lagos. God forbid that he touched that somewhere like Zamfara or Kano or Sokoto, where there are no, emergency responses that could pick him up immediately. Maybe we could escape COVID for believable. I don't want to take the jab. I don't think it's true. But Ebola was deadlier than COVID. But because we have a system that easily contained it, and then someone had to pay the ultimate price everywhere that was why we were able to contain the spread of that COVID. Of that Ebola. Imagine if it had gone out of Lagos. Or imagine if the person had even made bigger contact with people in Lagos. Lagos is densely populated. Imagine if you arrived at the airport in a time where there was chaos everywhere, and then it was talking to people, there was fluid contact, there was sweat, and then it begins to spread. It would have been because whatever breaks down Lagos, some states cannot survive it in this country.
True.